Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the perspectives of pharmacoeconomics. Patient perspective, provider perspective, payer perspective and the social perspective. These are after the selection of perspective, next step is the cost related measurements. First, the direct medical cost. Second is the direct non-medical cost. Third is indirect non-medical cost. And fourth is the intangible cost. And fifth is the opportunity cost. First is the patient perspective. All the relevant costs and the consequences experienced by the patient. Included cost, direct, indirect, and intangible. There are the provider perspective concerned with the expenses of providing product or services, including cost, direct cost only. Payer perspectives means the social security, government, third party payers, example that is the private insurance companies and the employers. Included the cost that is the direct cost, indirect cost and relevant to employer, lost the work days, lost the productivity at work. Next is the social perspective. There are the broadest of the all perspectives that comprehensively evaluates all costs and consequences and consider the benefit to society as a whole including cost. The next is the direct overall cost of the providing care, indirect that is loss of the productivity. Eco model, that is the eco model for the pharmacoeconomics, their perspectives, economic outcome, clinical outcome, and the humanistic outcome. Outcome parameters, that is the clinical as a result of the disease or treatment, survival, mortality, and morbidity. Economics, that is direct, indirect, and the intangible cost. Humanistic, that is the patient preferences, utilities, and the quality of life. Next is the types of study. There are the types of study that is the cost minimization analysis, cost effectiveness analysis, cost benefit analysis and the cost utility analysis. These are the types of study. First is the cost minimization analysis that is the CMA and compares the cost of the two or more alternatives that have a demonstrated equivalence in therapeutic outcome. Relatively straightforward and simple method. Least cost alternative is chosen. Example like the brand versus generic products and the different antibiotic therapies and different route of the administration of a same drug. There are the cost minimization analysis that is CMA in a drug therapy. Acquisition cost drug A and drug B is 250 and 350. Administration that is 75 and 0 and monitoring that is 75 and 25 cost and adverse effect are the 100 and 25. There are the subtotal is the 500 and 400. Outcome is that antibiotic effectiveness is 90% and 90%. So in today's class, I discuss about the cost minimization analysis that is CMA and also about the types of study, outcome parameters, eco model and about the perspectives. Thank you for watching.